I welcome all the doctors to the first free webinar series, Share of KHMA, as a mark of our association's third year anniversary. The recorded version of this session will be available later on in our YouTube channel, KHMA. Now, I would like to welcome our President, Dr. Veerupramachari sir, to welcome the gathering for today's session. Yes, sir. You can take over now.
I would like to welcome today's speaker, Dr. N Madan, senior most homeopathic physician and one of the best physician in India. I welcome all the doctors and students. I am confident that most of the doctors will get benefit today's lecture. Thank you, Bharat.
Welcome, sir. Now, I would like to give a brief introduction for today's speaker, one of the senior homeopath of Karnataka, Dr. N Madan, sir. He completed his BSc from APS College, Bengaluru in the year 1975 and did his GCEH in 1985 from AM Sheikh College and completed his MD Homeopathy from Beed College, Maharashtra. Later, he worked as under the guidance of late Sri Dr. A.V. Krishnamurthy at Ashwini Homeo Clinic, DVG Road, Basankudi. With an enormous clinical experience of more than 36 years, he has also served as professor and HOD of Department of Surgery at Bhagwan Buddha Homeopathic Medical College, Bengaluru. He was also awarded the prestigious award of Professor Emeritus from Rajiv Gandhi University of Health and Science in the year 2020. Till date, he has been an inspiration to many younger homeopaths like us. Coming to today's topic, homeopathic management of current situation of viral infection and pandemic outbreak. A very apt topic at this moment. So I would like to welcome Dr. N Madan sir to take over the session, sir.
Today's information is the management of current situations of viral fever. I hope you are all hearing me.
Yes, sir. It is audible. You can put it on the chat box. I'll convey it to sir.
Yes.
Any messages, I'll convey to sir. Participants can put it on the chat box.
Sure.
Yes, sir.
The present situations are, I will just hurry the subject. The present situation is fever, respiratory problem, and side effects of vaccination, what we are managing with in our clinic, and my experience with such things. Earlier, when this COVID started, you could have seen that the arsenicum album, some Restox, Camphora, many of the drugs were being suggested. Of course, they are all one of the medicines which can tackle the, which could tackle the situation. Now, of late, as we have observed in many cases, the arsenicum album did not help. Then what next? The main thing is that you should start observing the symptoms of the majority of the cases. In that, we found that many complained of severe backache, severe headache, and bony pain, which also get covered with Eupatorium perfoliatum. As we have seen in so many of the cases where even the Eupatorium perfoliatum was prescribed, with each dose, in many cases where there was very severe, we have repeated the medicine in water every half an hour, and those cases where it was mild, we have given even every 2 hours, depending upon the intensity. And we found that the Eupatorium perfoliatum, which produces the severe bony soreness and bodily pain and severe backache, could be corrected with Eupatorium perfoliatum, and majority are improving. You must have observed in the acute cases, the moment the patient come, though they have all the symptoms of bodily pain, cold, cough, throat pain, whichever troubles them this more, they express it first. So now, as we observed in many of the cases, we could see many complain of severe bony pain and backache, which made us to select the Eupatorium perfoliatum. And in Eupatorium perfoliatum, they are worse by movement, where the Rustox, they are better by movement. Though both corrects dengue, both corrects influenza, both have, which corrects the viral infections like influenza, dengue, herpes, chickenpox. These things with which covers the major portion of the viral infections, but the difference of symptom which we saw was more of bony pain and backache in Eupatorium perfoliatum and more of respiratory problem with Rustox. And in some cases, we could see even the severe loose motion with gurgling in abdomen, which could be corrected by the Jatropha, which has the gurgling sound in abdomen and bringing the watery stools in majority. And in now also, in such cases where they could not get Jatropha, Jatropha belongs to the natural order U4BAC. So your castor oil also belongs to the same natural order U4BAC, where a drop of castor oil in half liter of water, we ask them to shook well, which from material which goes to the nano level, and even on taking that, there was improvement with the loose motion. And in some cases of the vaccination side effects. In vaccination side effects, what we could find was in many cases, there was increase in the platelet level. That platelet level increase, which had brought to the condition of clotting. So when there was already clot, the verbena, if you read verbena in boric, which has the capacity to dissolve the clots. So verbena has helped in many of the cases of clots. And when in some cases after vaccination we found some of the patients had the paralysis on the right side and some of the patients were having the paralysis on the left side. In patients with paralysis on the right side could be corrected with Crotalus horridus. And in some cases of paralysis in the left half of the body, so the lachesis had cleared the paralytic condition as well as the nervous weakness. The purpose of selecting Crotalus horridus and lachesis is the Crotalus horridus is also a vipera, lachesis is also a vipera. If you study Crotalus horridus in Murphy, you can see that it also indicates the side effect of vaccination, which made us to think of Crotalus horridus, which can cover both the side effect of the vaccination as well as the paralysis, which could cover both right side paralysis by Crotalus horridus and left paralysis by lachesis. In some cases of the viral fever, we could see that the lungs were getting affected frequently, where there was the patchy pneumonitis, and also the complete consolidation of the lungs. If you read the Murphy, the drug Lomatium disectum, which is an Indian carrot, also could be used in clearing the pneumonitis, the influenza, as well as the consolidation also in many cases. The idea of selecting Lomatium disectum is in the year 1918, when there was an epidemic of influenza, where many died as it happened in this endemic. In northern Nevada, the local Washoe people were recovering without any problem, and there was not even a single case of death. And the complication. A local medical practitioner called Krebs, who was an MD in Carson City, was surprised to know that no one is getting affected there. So he thought of studying the cases there and found that they were taking the water boiled with carrot, which was curing their influenza and also the pneumonitis. On that basis, what we did here, in cases of where there's more of lung affection, we asked them to chew a small piece of carrot and to drink a small tumbler of water every 2 hours, which gave them the relief and also which prevented them going to the hospitalization or going into ICU. In some cases of consolidation, we have given even prescribed chelidonium, where chelidonium has the capacity to correct the hepatization of lungs. So on that basis, chelidonium was given every 2 hours. And as you know, there's the consolidation of the lungs, which decreases the oxygen absorption. In such places, along with the chelidonium, which were given every 2 hours, and carbovage 1 m to repeat in water every 10 or 15 minutes, depending upon the intensity. And we found that they were in less need of oxygen supply and could be corrected in many cases, even without oxygen supply. And in some cases, the complaint had started through the throat pain. So after the throat pain, there was a severe dry hawking cough where they were unable to sleep. In such cases, we have seen that the laryngeal edema, the edema of the glottis, which were bringing the severe cough and leading to, after the throat pain, leading to the congestion in the chest, could be corrected with Vyathia. Many times, many of my friends asked, why not Sticta? In Sticta, what happens? It starts with the nose and the cold, not from the throat. From nose, it goes to the throat trouble. From the throat trouble, it descends to the lungs. And if you compare this with Ambra gracia, in Ambra gracia, cold, throat pain, cough, congestion all persist together. Whereas in Sticta, it descends. First it starts with cold. Cold will become better. Then goes to the throat irritation and throat pain. Then throat irritation and throat pain goes and they land in lung congestion. So that's the difference we found in Sticta and Ambra gracia. So in many of the cases where there is a colchicum were also indicated, where there was a severe nausea at the site of the food as the main indication of colchicum. But in colchicum, what happens? There is no severe bony pain in colchicum, where there is a coldness and numbness of the extremities you will see in colchicum, whereas in Eupatorium perfoliatum, you will find the nausea at the site of the food also. Plus, the main indication is that bony pain and the back pain, which were troubling them with fever and severe headache. So that made us to decide Eupatorium perfoliatum than colchicum on seeing the difference of bony pain, which that's nausea at the site of food, which we will see in both the cases. After the viral episode, fever, we have seen in some cases there is severe cough. In some cases, there is extreme tiredness. In some cases, increase of their blood sugar, which is happening even after the vaccination side effect. In all such cases, where now you must have observed in many cases of diabetes, despite taking insulin, their blood sugar is more, 300, 400 like that. But we have seen in such cases after giving spongia, because spongia contains iodine, spongia, because of the presence of iodine, it can correct the TSH. That means it has the affinity towards correcting the pituitary, and it also has the affinity to correct the chronic pancreatitis. So where it has the capacity to correct both the TSH, the pituitary, and the pancreatic. On that basis, we have seen, we thought why we should not give spongia and see in cases where there is an increased blood sugar. After giving spongia, we could see that the blood sugar which increased as the side effects of vaccination and also the after effect of the present viral fever. So we are seeing of late the increase in the thyroid cases, increase in the infertility cases, increase in the blood sugar, which are all the endocrine problems, is due to the indiscriminate use of iodine through salt and also the electromagnetic rays of the cell phone towers, which are affecting their pituitary. And invariably, we are seeing the AMH, that is the anti-Mullerian hormone, which is responsible for conception, is not have increasing, or the cases of infertility is due to the lack of AMH or getting corrected with spongia and also magnetic poli ambo, which many times we have given in alternation with magnetic poli ambo and the spongia, and many times we have given the combination of magnetic poli ambo, spongia and pancreatic or pituitary when there are both problems were there. So we are seeing there is improvement in the ovarian cyst, reducing the blood sugar, and also in reducing the thyroid problem and increasing the AMH and helping for conception. And not only that, you must have observed of late, those who all had the complication of the COVID, many of them are diabetic. So it is the tubercular miasm which causes the diabetes as well as the respiratory problem, asthma. On that basis, we have seen after giving tuberculum aviare, which has more affinity towards the lungs and could be corrected permanently after taking tuberculum aviare. And many times we have prescribed our medicine on the basis of laboratory investigations also. After studying many cases, we are seeing in some cases there is increasing in total count, total white blood count. So on that basis, if you read Boric, you can see the in benzenum says there is increase in white blood corpuscles and decrease in the hemoglobin RBCs. So we have seen on that basis when there was the cases where the WBC were more after getting checked, even many times we have seen along with the benzene, along with the increase in the total count, there is decrease in the platelet. So in such cases also, benzenum has helped in clearing the condition, increasing, decreasing their white blood corpuscles and increasing their platelets. And even the fever has come down after prescribing benzenum, basing on the laboratory report. In some cases, in majority of the cases of late, you must have observed, when you see the CBC plus ESR, their lymphocytes are coming down. That decrease in lymphocytes, which spoils their immunity, which make them to yield to the present infection. After prescribing arsenicum iodatum, because arsenicum iodatum has the capacity to correct even HIV and it has the capacity to correct the lymphocytes. So on that basis, after prescribing arsenicum iodatum 200, we have seen there was tremendous improvement with the patient's condition, as well as their lymphocytes has improved. In some cases, we are seeing though the dengue is negative, their platelets are coming down. So in such cases, where after prescribing Crotalus horridus, and in some cases where there is a family history of cancer and diabetes, even Calcarea ars has improved their platelet and have cleared their sickness. After this, after the episode of fever, as I told you, some are suffering with weakness, extreme prostration. So usually the general extreme prostration without any reason getting corrected with Senna, S-E-N-N-A. After prescribing Senna 1M, every 2 hourly for 2 days, we have seen they have improved tremendously. And also where there is an extensive family history of diabetes, the alfalfa has brought the strength in the patients. In some cases of after fever effects, we are seeing even blurring and sensitive to light in some of the cases where the bathrobes had improved the vision and their condition also. The spongia is being prescribed in the cases where there is severe cough, where many times we have seen the patients where even the attempting to speak also has the severe cough, which usually looks like the Hyasiamus cough, but spongia, though that particular noise of spongia is not there, because of this, after effects of vaccination and fever treatment, we are seeing spongia is bringing down the cough and getting them their health back. I hope many of the problems I have covered. If there is any doubt, please revert. Thanking you all.
Thank you, sir. I would like the participants to put in any questions. You have 2 minutes time. Any questions, you can put it on the chat box so that I can convey it to sir.
There are 6 chats.
Question. Phosphorus high in lab test. One of the participants, Smita, is asking, when there is phosphorus high, what to do?
You can give phosphorus 200 itself. That will antidote it. And even in many cases of CRP, which is happening due to the destruction of the tissue, CRP increases. In cases of CRP also, the phosphorus 200 has helped in bringing down the phosphorus.
Next question is hypertension after COVID infection, sir.
Yes, hypertension after COVID infection, any after effects of COVID are getting corrected with spongia, because it has, see, even to increase in the hypertension, adrenaline glands are responsible, which are controlled even by the whole hormone system. We are seeing after prescribing spongia, majority of the after effects of COVID are getting controlled. The sugar level, hypertension, extreme weakness, severe cough and lung infection are getting corrected with spongia. And if you read spongia in Murphy, you will see how extensive and how much is suitable with the present situation. Patient complaint, significant insulin resistant after infection.
Yes, sir. Yeah.
See, if you study the diabetic cases, you will see 2 types of diabetes. One is insulin resistant diabetes. Second one is insulin deficient diabetes. According to them, insulin resistance is due to the autoimmune condition. Body itself is not reacting to their own, getting destroyed by their own antibodies. And there is a failure to the reaction to the insulin. The failure to the reaction of insulin is once again a failure in the normal milestone, which are getting corrected with syphilinum, because it is the syphilitic miasm which destroys the reaction of the body to the normal conditions. So we are seeing, as I said, the diabetes is a tubercular miasm which contains sora and syphilis. When the same syphilitic miasm goes to the pancreas, destroying the Langerhans cells reaction, when it comes to the general system, it destroys the general reaction to the syphilis. On that basis, we are seeing after prescribing syphilinum and spongia in alternation, they are improving with the insulin, resistant to insulin get clear, and they are improving with the treatment.
Okay, sir. One more question is, sir, in most of the cases, patients complain of upper extremities pain, not overall myalgia, only hand pain during viral fever.
Yes, the hand pain is more in the left or right, also depends on that. if it is more on the right, we are seeing lycopersicum is helping the right arm pain. In left arm pain, it is getting cleared with spigelia. When both the arms are paining, it is terebinthina that helps in clearing their arm pain. And even there is, in one case of a post-COVID case, there was a trembling in both the arms as well as legs, which got cleared with lolium tumultinum. If you study lolium tumultinum in Murphy, you will understand how it works, because it covers a major portion of the Parkinson's syndrome, the writer's cramp, all these things, particularly trembling of all the limbs, is lolium tumultinum. I hope I am clear.
Yes, sir. Yes, sir. Is spongia advised for increased random blood sugar after fever or vaccination?
Yes, both. You study spongia in Murphy, you will understand how extensive in such cases, how extensively it acts in such cases.
One more question. Can we think of stannum met or zingiber in hoarseness with cough?
See, stannum, the cough is more in the day. Gingiber is more after midnight. The exact midnight is arsenicum album. Above by 1 a.m. and 3 a.m. is gingiber, severe cough, which make them to sit up in the bed, is gingiber. So you can, and the taste of the sputum in the stannum is sweetish, whereas the taste of the sputum in gingiber is insipid. So depending on that, you can select, why not? And I also say, what all the drugs I have told, not only those drugs are limited to those drugs. If you find any indication of any drug in any of your case, see, in one case I tell you, there is a case of fever. After the the important thing I saw in that fever was, she said, when I vomit, it will be very sourish. After some time, I feel the whole mouth is sweet. Is it not? So in mango, when it is raw, it is sour. When it becomes ripened, it will be sweet. On that basis, after prescribing Mangifera indica, even her vomiting stopped and the fever also got clear. Why not? Is it not?
Yes, sir.
So there is no hard and fast rule that you should prescribe only these medicines. You may find in some other indication of some other drug in your case, you can do it. That's why I don't say I took this case and these are the symptoms and these are the medicine. But many times, even your repertorization may fail, but you may find a different indication for that condition. So you can prescribe which makes the nucleus of that patient.
Sir, one last question I'll take up. There's one question. Increase in creatinine level after post-COVID.
That is usually their treatment. Usually in many cases they have prescribed even antibiotic. That antibiotic has brought down the kidney function. In such cases, we have seen of prescribing Nux and eel serum. And many times there will be pre-renal failures. That means because of the lack of water supply or the sufficient circulation, because of the lowered BP also, there can be a pre-renal failure. If there is no proper blood pressure to the kidney, there can be lack of filtration and causing the kidney failure, which they call it as pre-renal failure. In such cases, CarboVeg has improved. The serum creatinine recently 2 days back, there was severe vomiting and loose motion, and there was no urination, and they think the serum creatinine increased to 4. They wanted to do the dialysis. After stopping vomiting and loose motion with camphor, because there was an extreme coldness of the extremities. After stopping vomiting and loose motion, the patient's urine output has increased, and naturally the serum creatinine came down. So in such cases, depending upon the cause, depending upon the symptom, you can select the medicine. So in such cases, we are seeing after prescribing Nux and Eel serum has improved their urine output and reduced the serum creatinine. Am I clear?
Yes, sir. Yes, sir. Yeah. Okay, sir. I think we can close the session. Thank you,
sorry,
sir.
due to the technical problem, I could not come early.
Yes, sir. No problem, sir. But participants were eagerly waiting for your session, and yeah, till now we have full participants till the time you were there here. Thank you,
And,
sir.
If this session is unsatisfied, let us keep another session also. I don't mind.
Sure, sir. On the basis of participants' requirement, we will definitely start do one more session in near time.
My
very
pleasure.
soon. Fine, sir. Thank you very much, sir. Thank you for your valuable information. Hope it has enriched the knowledge of all the participants. The wait, longer wait, the participants which they had. I think the information given, it would have been satisfied for them. In near future, definitely we will take up one more session, because only a half an hour or 45-minute session is not enough. Just to get the knowledge from one of the senior most homeopath who gives you information when you just ask a question, he's ready with the information. Such kind of a person is Dr. Madan sir. Thank you, sir. Thank you very much for this session. Participants can share your feedback on the comment box. We'll just take that, and we'll continue the share series of from KHMA. Most probably according to the availability of the next speaker, and hopefully we'll bring back Madan sir in the next session. Okay. Thank you everyone. And the recorded version will be edited and uploaded in our KHMA YouTube channel very soon. Thank you all. Thank you very much.
Thank you. Thank you for giving.
Thank you, sir. I thank all the participants as well as the our president, Dr. Veeru Brahmachari sir, working president, Dr. Rajesh sir, and our general secretary, Dr. Niranjan sir, for encouraging me in starting this series of share through KHMA. Hope the participants, the younger generation homeopaths, start practicing homeopathy, start seeing more such cases involving more of homeopathic medicines prescription, learning more of it, and let's share knowledge and let's learn together. That is what we wanted to show to the participants from this session. And we'll come back soon with one more session. And thank you. Thank you very much.
Thank you.